Soliqua, a fixed-ratio combination of Lantus and lixisenatide, combines the powerful control of insulin glargine 100 units per milliliter with the complementary action of a prandial glucagon-like peptide-1 receptor agonist, or GLP-1RA, to help patients manage both fasting and postprandial glycemia in a once-daily injection. As you may know, type 2 diabetes is a complex disease with multiple pathophysiological abnormalities, calling for treatments that target its various underlying pathogenic mechanisms. So let's take a look at how these classes of treatments, basal insulin and GLP-1RAs, work to address them. Basal insulin therapy targets fasting glucose control by activating insulin receptors to stimulate glucose uptake into skeletal muscle and fat and inhibiting hepatic glucose production. So while basal insulin targets the liver, fat and skeletal muscle, let's take a look at how GLP-1RAs target additional pathophysiologic abnormalities associated with postprandial glucose. GLP-1RAs mimic endogenous incretin hormone GLP-1, the secretion of which is impaired in patients with type 2 diabetes. GLP-1RAs act on beta cells to stimulate insulin secretion following meals and suppress glucagon secretion from pancreatic alpha cells. Going deeper into the bloodstream, we can see that GLP-1RAs stimulate insulin secretion naturally in response to elevated blood glucose levels after food intake, but not at normoglycemia, thereby limiting the risk of hypoglycemia. Meanwhile, glucagon secretion by the alpha cells is suppressed. Prandial GLP-1RAs also delay gastric emptying, thereby attenuating postprandial glucose excursions. And finally, GLP-1 receptor activation decreases anticipatory food reward in the brain, which may reduce craving for food and increases consummatory food reward and satiety, thereby potentially preventing overeating. Thus, the combination of basal insulin and a prandial GLP-1RA targets multiple pathophysiologic abnormalities in type 2 diabetes, addressing both fasting and postprandial hyperglycemia while mitigating the weight gain associated with basal insulin treatment. Why are complementary modes of action and addressing PPG as well as FPG important? One reason is the need to address uncontrolled HbA1c in as many as 3 out of 5 patients taking basal insulin. Even when basal insulin has been titrated to an acceptable FPG level, HbA1c may still be uncontrolled. A look at the underlying mechanisms of type 2 diabetes may offer some insight. Patients with type 2 diabetes may not have enough insulin secretion to manage either basal or post-meal blood glucose levels. While basal insulin may reduce the overall picture of hyperglycemia and achieve FPG targets, patients may still experience periods of elevated glucose after meals. The contribution of a prandial GLP-1RA can reduce postprandial glucose excursions and, together with the basal insulin, address both FPG and PPG. Let's now take a look at how Soliqua, by combining basal insulin and a prandial GLP-1RA in a single injection, affects both FPG and PPG in patients who have not been able to reach their HbA1c goal on basal insulin. In the LIXIL-ANL study, Soliqua demonstrated superior HbA1c reduction versus insulin glargine 100 units per milliliter at week 30. Soliqua lowered HbA1c from a mean baseline of 8.1% to 6.9% versus 7.5% with insulin glargine 100 units per milliliter in patients who had been previously titrated on insulin glargine 100 units per milliliter. Note that the mean final insulin doses of Soliqua and insulin glargine 100 units per milliliter at week 30 were equivalent. In addition, nearly 3 times more patients taking Soliqua achieved their HbA1c goal without weight gain, and Soliqua also helped more patients achieve their HbA1c goal without documented symptomatic hypoglycemia. The most frequently reported adverse reactions during treatment with Soliqua were hypoglycemia and gastrointestinal adverse reactions. Common adverse reactions included dizziness, nausea, diarrhea, and vomiting. So for patients taking basal insulin, but struggling to achieve glycemic control, who may seem overwhelmed and resistant to the idea of a more complex treatment regimen, Celequa offers more complete glycemic control than insulin glargine 100 units per milliliter, with fasting and postprandial glycemic management in a once-daily injection.